the most important thing is just the fact that our emphasis very much is on fellow training here. We want outstanding care in retina, and we want outstanding teaching of our retina fellows.
Well, it's a pleasure to welcome all of you to the Kresge Eye Institute. As chair, I have the great honor and privilege to build upon the shoulders of others who really started the Kresge Eye Institute, from Dr. Jampel to Dr. Abrams. We're very fortunate to have the retina service, vitreoretinal surgeries, as the premier service within the Eye Institute. It's one that we're extremely proud of. We continue to build and develop, that is not only locally, nationally, but internationally known and very committed.
I'm Gary Abrams.
I'm Deepa Yoganathan.
And welcome to the Kresge Eye Institute. It's a beautiful fall day in Detroit, as you can see, beautiful sunny day. This is the way it is almost all the time in Detroit. We never have to worry about it being too hot, nor do we have to worry about it too cold in Detroit. So this is the way it almost always is.
And Gary never fibs.
And here we see our Kresge Eye Institute here. What we're going to try to do today is just give you a little walking tour of Kresge and give you an idea of where you'll be working. Want to come with me? This is a building that was built in 1991. That's when the Department of Ophthalmology moved here. We were previously over at one of the hospitals where the Kresge Eye Institute has been located. But in '91 we relocated to this building. It's a 77,000 square foot building. It's got all of our clinical space. It's got our research. The fourth floor is all research space, and it's fully integrated space where we can really have all the room we need to see all of our patients, take care of all of our clinical activities, and then we've got this great auditorium here. We'll seat I think almost 200 people, and it will allow us to have CME meetings. And all of our grand rounds are always here. Now, if you were coming for a live interview at Kresge, this is where you'd be hanging out during the day between your interviews. This is we call it the Charlotte Failing Boardroom. We're on the second floor of the Eye Institute here, and here we have our Wall of Fame. This is all of our former residents and fellows. You can see all lined up here, pictures going back into the 1970s. So anytime you're trying to remember who used to be here, you can always come here and find their picture and their name. Here is our imaging department. This is really one of the highlights, I think, of the department, is our ability to do really what I call first-class imaging. Why don't you come on in with me? Here we've got, you can see the Optos California, which is really has become main. It's amazing to me that now it seems like the majority of the photos that we get are taken on the Optos. But we've got Optos and, of course, the traditional 50-degree TopCon imaging as well. We have multiple OCT machines. We've got both the Heidelberg as well as the Zeiss Cirrus.
We have 3 Zeiss, 1 Heidelberg, TopCon,
Okay.
and 2 Optos. Here we have our Heidelberg OCT and angiography. Our TopCon cameras over here. We have an electrophysiology lab and an ultrasound lab as well. We can go pass by.
One of the other things we're fortunate to have here at Kresge is really a quite complete vision lab, where we have electrophysiology, microperimetry, and some other testing that will be quite useful for you as a retina fellow. Right here we've got an MP3. I really like the MP3. It's a great microperimeter, one that you can really tell. Somebody with subtle vision loss, you can really check it out and find out exactly what's going on. We've got here, we've got full field as well as multifocal ERG. You can see we got an octopus perimeter right here. We've got a physician who takes care of the laboratory, does our testing, and it's very user-friendly, very easy to do, and somebody who will be really there for you when you need testing, as well as helping you interpret the testing that you're going to get. Well, next door to the vision lab, we have ultrasound, and we've got really quite an excellent ultrasound facility. Why don't you come on in with me and let's look at it. This is Connie, who has been doing our ultrasound for 20 years.
About 20 years. I've been here 32.
Yeah, she's been doing our ultrasound for 20 years. It's amazing to me, Connie has gotten so good that there's never any question about if she thinks there's a retinal detachment, and I maybe disagree, she's almost always right. Connie, you want to show us your unit here? So what we can do is, if we've got a patient, we can just send them down. Connie will take care of it. We try to make sure that the fellows learn to do ultrasound, and because you're going to have to be able to do the ultrasound yourself and be able to interpret. So we will, you'll be getting continuing instruction in ultrasound throughout your fellowship. But really the ability to get really excellent ultrasound is always here at Kresge. This is what we call the laser suite. This is where we'll do our laser procedures. When we come in, I'll show you. Here we got the laser set up, ready to go. Both slit lamp and indirect, as you can see.
Here we have the Kresge Eye Institute resident clinic, where there's a walk-in clinic every single day, all day, and the residents and faculty supervise the walk-in clinic, so you'll be spending a day a week here. Let's go check it out.
This is where really much of the action at Kresge Eye Institute takes place. Frankly, this is where the most interesting patients are always found. You never know what's going to walk in. You walk in one day and there's a retinal detachment, another day massive trauma, the next day TB, uveitis. I mean, you never know what's going to show up. But the fellows be interacting with the residents very frequently. You'll be spending a lot of time coming in consulting on patients in the resident clinic. 2 days a week we have actual retina clinics here in the resident clinic. They usually one of the fellows and one or two of the faculty will be present during the retina clinic, and you'll have a large number of patients that are brought in by the resident service to be seen by the retina service. I think it's really an ideal situation. You've got the patients with complex disease. You have opportunity to be able to gain hands-on experience, and then you have excellent supervision to make sure that when you do something that you're doing it right and learning to do it correctly.
Hi there, I'm Christopher Chapman. I'm one of the retina attendings, and I was actually a chief resident here many years ago and joined Gary and the group about 3 years ago. And I bring a vast repertoire of both private practice but also academic experience here to Kresge. So my philosophy here is that I'd like to teach the fellows how to anticipate complications, manage intraoperative complications and postoperative complications, and I believe in a very hands-on approach for the fellows in the operating room. So there's certainly no shortage of cases here for you. So if that's your philosophy, is to do more cases, you'll definitely get that here. This is the retina suite where we see most of our retina clinic patients, obviously. We usually have residents and fellows, technicians and visiting scholars as well from other institutions and medical students. So it's quite busy.
So I think this is really one of the best fellowships that you'll find for surgical training. I think you can talk to any of our former fellows and they're going to confirm that. In the clinics, we have a wide variety of retinal cases coming in. We've got tremendous amount of uveitis that comes in at Kresge Eye Institute. Recently, Dr. Lin has set up a uveitis clinic. In the uveitis clinic, we have a board-certified rheumatologist who is personally involved, who's actually present in the clinic when we're doing the evaluation and treatment of these patients. So in one visit, the patient is able to get uveitis evaluation by Dr. Lin and ophthalmology, including a retina fellow. And we are able to then institute treatment, which very often, as you know, now includes immunosuppressive therapy. And we have a board-certified rheumatologist right there in the clinic with us to be able to help us manage those patients. So it's really the ideal setup. Here's the fellow's office. And so you can see there's a space here for all three of the retina fellows and the glaucoma fellow as well. You can see you've got your own workstation, your own desk and your own workstation here in the fellow office. All right, we're on the 4th floor of the Eye Institute now, and the 4th floor is where we have basic research. And one of the labs most important to the retina service is the laboratory of Dr. Ashok Kumar. And this Dr. Kumar's laboratory, the fellows have been interacting with Dr. Kumar and his laboratory a great deal the last few years.
Sort of working with a lot of retina faculties and try to identify, helping them in diagnosis with infectious agents. So we have a multiplex PCR, try to identify whether etiology is a bacterial, it's a fungal, or it's a viral, and it's going pretty well.
No, this is really, I think this is really groundbreaking. It's we're now able to very quickly determine whether it's a fungal organism. One of the more recent interesting things was a patient who we were looking at and thinking in terms of this toxoplasmosis. Turns out it's actually a fungal infection.
Yeah.
And we determined this very rapidly with PCR, and Dr. Lin just went in and did a vitrectomy on the patient and treated with antifungals. And I think we would have been at a very delayed diagnosis without the new multiplex PCR.
Yeah.
So I'm very excited about this.
Absolutely.
I'm C.C. Lin. I'm one of the retina faculty here. Today we're going to show you around in the operating room. So this is the Detroit Medical Center Outpatient Surgery Center. This is where we do the majority of actually all of our retina cases. We have two rooms that's pretty similar, and this is our main machines here. We have the Constellation for the two Constellations here, and then we have a couple of Centurions for the anterior segment part of things. This is where we're going to do all of our retina surgeries. We have a wide spectrum of surgeries we do here that covers the entire spectrum of retina surgeries, uveitic surgeries, some ocular tumors. We don't do melanoma, unfortunately, but we do lymphoma, any kind of intraorbital or intraocular subretinal biopsy we will perform. think you'll find that surgical pathology here is not just a wide range of it, but also very complex surgical pathology. All of our intraocular lenses cases will be here. We'll explore different ways of secondary IOL, complex anterior segment cases, including anterior segment reconstruction. That's generally done by the retina service here. The other thing we do quite a bit here is scleral buckle, primary scleral buckle, and we'll do, as a fellow, you'll become very confident in terms of scleral buckling. In fact, I think you'll be one of the top bucklers in your graduating class. And we have 3 rooms that's dedicated eye rooms, fully functional eye rooms. Typically, at any one time, 2 of the rooms will be running. Sometimes all 3 will be running. Sometimes it will be 2 retinas running, or retina with anterior segment running. The room 2 and room 4 are the retina rooms, and they have basically exactly the same setup with ceiling mounted microscopes and bioimaging system. And then each of them can have a constellation machine. So technically, both rooms can be running retina cases at the same time. The outpatient or the pre-op and post-op area is just a doorway. It's for a relatively quick transition. And we try to make the turnover relatively smooth and as quick as we can. So typically here, we'll do anywhere from 3 to 4 cases in a day. For my days, all the way to 7 to 8 cases a day. Typically speaking, it's around 5 to 6 cases a day.
I'll share a couple of my favorite things about Kresge. What I tell the fellows all the time is that our OR situation is very unique. The fact that our anesthesiologists and our nursing and scrub techs are so patient with the fellows means that they can continue to operate and operate and operate for as many hours as we decide to. So what I tell the fellows is similar, I think, to what Dr. Lin and Dr. Chapman do as well, is this is your OR, you run the OR, and take ownership of the cases and the structure for the day. And we are in a unique situation that the staff in the operating room allow us to do that. Another great opportunity I found here at Kresge is the amount of teaching that we can do and the amount of conferences that we've been able to run. We have 40 hours of surgical retina conference. You will see that we talk about retina all the time. We pass each other in the hallways. Our offices are very close to each other, and so we're constantly sharing details about patients and asking each other advice about patients. We do that formally in a monthly surgical conference that can go for at least 2 hours.
We have a tremendous amount of opportunity as far as treating patients medically as well as surgically. You will get tremendous experience in laser treatment. You'll get tremendous experience in injections, anti-VEGF therapy of diabetes, as well as macular degeneration. We do see a wide variety of macular diseases. The fellows are in all the clinics, and they'll be helping to manage patients with a wide variety of macular diseases. So I really think this is one of the great opportunities for fellowship training here at Kresge Eye Institute. And we really do look forward to meeting you, even though it's going to be virtual this year. And we look forward to working with some of you in the future.